Okay, so this is another procedure we used to do on our old cysto table. It's a patient with gross hematuria. We're just going to do a cystoscopy. Not quite sure what we're going to find. We don't utilize fluoro or any other imaging for this procedure, so a lot of times we move the C-arm out of the way. Makes it easier to move the patient on and off the table. They're not hitting their heads on the equipment. So we're going to go ahead and get started with this in just a minute. Again, it's a patient with prostate cancer who has gross hematuria. So here's his urethra. There's a lot of kind of strictures in there. So we're looking to see if he has some sort of secondary malignancy in his bladder. We're trying to find a cause for his blood in his urine. He may have radiation cystitis. He's had previous radiation. And that blanched appearance of the bladder kind of looks like radiation cystitis a little bit. So far I don't see any bladder tumors. There's some debris in the bladder. So just surveying his bladder. So far I see no cause for the blood in the urine. Although again, he's got hormone refractory prostate cancer. Now there's a little dystrophic calcification. So we're going to take one more look at his prostatic urethra. So he's got, that may be the source of the bleeding right there, which is probably some, again, he has hormone refractory prostate cancer. So this kind of tissue has a tendency to bleed sometimes here. It's probably recurrence at his anastomosis. You know what, let me have a bug bead. Let me just cauterize this real quick. We use this table for percutaneous nephrolithotomies also. And the two we've done, one has been from each side of the table, so it comes in handy that we can switch the C-arm so we can work on the opposite side. So this looks like it may have been a source of his bleeding. Just going to cauterize it a little bit. All right. One little tiny blood vessel bleeding there, we'll get that. Yeah, so we're getting a much better picture now with the high resolution, high definition monitors than we used to. Although we're somewhat hampered by our cameras are going to be updated soon. That's from our surgical vendor. We're going to get newer cameras that'll give us an even better picture. But the picture is a nice big image we can see, and you don't have to strain to see a little small little monitor. It's much better for us to ergonomically to work with. Now it's stopped, so we're done. So you can wake them up.